Welcome to Week 4 Psychosocial Integrity. In this section, we focus on promoting emotional, mental, and social well-being through holistic nursing care. Psychosocial integrity means understanding the human behind the illness, their feelings, fears, coping mechanisms, and social environment. As nurses, we don't just treat disease, we care for the whole person, mind, body, and spirit. Our goal is to help each patient adapt, connect, and regain balance in life. Therapeutic communication is the foundation of psychosocial care. We use open-ended questions, active listening, reflection, and silence to encourage patients to express their thoughts and emotions. For example, how are you feeling about this change? We must avoid false reassurance such as you'll be fine, or giving advice like you should do this. True therapeutic communication builds trust through empathy and presence, showing the patient that they are heard and respected. Defense mechanisms are unconscious ways people cope with stress. Common examples include denial, projection, regression, and sublimation. For instance, a patient in denial might say, "I don't have cancer." A person using projection may claim, "My nurse dislikes me," when they themselves feel angry. Regression might look like childish behavior during crisis, and sublimation is turning negative energy into positive action such as exercising to manage anger. Recognizing these mechanisms helps us understand behavior without judgment. In this section, we review the most common psychiatric conditions encountered in nursing practice. Depression, monitor for suicidal ideation and hopelessness. Encourage verbalization and therapeutic presence. Anxiety disorders provide a calm environment, guide breathing and relaxation techniques. Bipolar disorder during mania, ensure safety, limit stimuli, and promote medication adherence. Schizophrenia, maintain reality orientation, set boundaries, and monitor medication side effects. PTSD, support grounding techniques and trauma-informed care. Our role is to promote safety, understanding, and stability. Psychotropic medications require vigilant nursing care. SSRIs, such as fluoxetine, can increase suicide risk during the first 2 weeks. Monitor closely. Lithium, a mood stabilizer, requires checking sodium levels and watching for tremors or confusion as signs of toxicity. Antipsychotics like haloperidol and risperidone may cause extrapyramidal symptoms, EPS or neuroleptic malignant syndrome (NMS). Benzodiazepines are effective for anxiety but must be used short-term due to dependence risk. MAOIs require dietary restrictions. Avoid tyramine-rich foods like cheese and wine to prevent hypertensive crisis. Always educate patients in clear, simple terms they can understand. Stress is both a physiological and psychological response. Coping mechanisms can be positive or negative. Our role is to guide patients toward effective coping, such as problem solving, relaxation, and seeking social support. During a crisis, the nursing priority follows 3 steps. Safety first, then build trust, and finally, identify the support system. In moments of instability or trauma, our calm presence becomes the anchor that helps patients regain control. Grieving is a natural process that follows loss. According to the Kubler-Ross model, the stages are denial, anger, bargaining, depression, and acceptance. Patients and families may move through these stages at different speeds. Our role as nurses is not to fix their grief, but to listen, support, and simply be present. Sometimes, silence and empathy speak louder than any words. For NCLEX questions related to psychosocial integrity, always start by ensuring patient safety. Therapeutic communication takes priority over medication or restraints unless safety is compromised. Avoid false reassurance, judgment, or advice-giving responses. Remember Maslow's hierarchy: safety, physiological, psychosocial. Questions often test whether you can identify the most therapeutic response, the one that builds trust and encourages the patient to express themselves. The nurse is the therapeutic instrument, the healing connection between suffering and recovery. We facilitate growth through consistency, empathy, and honesty. When patients sense genuine compassion and reliability, trust naturally develops. Every interaction from eye contact to tone communicates care. Our presence, more than our words, often becomes the most powerful medicine. Psychosocial integrity is about helping patients cope, connect, and heal. Through empathy, communication, and understanding, we guide them toward recovery and self-worth. As nurses, we must remember, empathy is the bridge between suffering and healing. Let that bridge begin with us every time we listen, comfort, and advocate for those in our care.